us now go to diagnosis through the teeth. The topic is bleeding gums, loosening of teeth, burnt black teeth. Bleeding gums. Blood oozing out between teeth or from gum lines is often a manifestation of fire in the body. For example, stomach fire and excess fire due to kidney deficiency can all result in gum bleeding. Gum inflammation is another cause for bleeding. Bleeding gums can also be a prominent symptom of scurvy. Heavy bleeding accompanied by bad breath indicates excessive fire in the gastrointestinal system. Pale red blood accompanied by rotting gums indicates deficient fire in the stomach. Pale red blood accompanied by loosening of teeth indicates hyperactive fire due to deficiency of the kidney. Red and swelling gums, the edge of the gum turning ulcerous, indicates gingivitis. Gum bleeding accompanied by loosening of the teeth indicates a sign of scurvy. Loosening of the teeth. Often seen in the elderly, the Yang-Ming meridian of the hand passes through the lower tooth bed, while the Yang-Ming meridian of the foot passes through the upper tooth bed. Teeth are considered the remnants of bones and rely on the gums for nourishment. It is not hard to see how closely the loosening of the teeth is related to the Yang-Ming meridian of the hand and foot, as well as the kidneys. Loosening of the teeth, red and swelling gums indicate overactive heat blocking Yang-Ming meridians. Loosening of teeth with dizziness and tinnitus and hair loss indicate deficiency of kidney yin. Loosening of teeth with sore lower back and difficulty emptying bladder indicate deficiency of kidney qi. Gum inflammation with too much tartar with periodontal pockets are caused by poor mouth hygiene. Burnt black teeth. The teeth are dry with a lusterless black tinge, often seen in patients with febrile illnesses and depletion of yin due to extreme heat. It is often suggestive of a poor prognosis. Burnt black teeth with dry mouth and dry tongue indicate hyperactivity of heat in the lower burner. Burnt black teeth that are soiled accompanied by dry throat and thirst, restlessness, and insomnia indicate depletion of yin due to stomach heat. Yellowish black teeth that are dry accompanied by shaky teeth roots with sore and weak lower back and knees and hair loss indicates insufficiency of kidney essence and wind cold invading the meridian. Tips for caring for your teeth. Number 1 is to rinse your mouth after each meal. Second is to eat more vegetables. The teeth are used to breaking down food and assist in speaking. It is important to have a set of healthy teeth, so rinse your mouth after each meal to remove food residue between the teeth. Brush your teeth before going to bed, as germs tend to grow when saliva secretion is limited during sleep. Eat more vegetables that are high in water and fiber, which help clean the teeth. Regular checkups of the teeth will help prevent dental diseases. A yearly checkup is recommended for adults. Thank you so much for your attention.
Let's continue our discussion about headaches. Headache is one of the most common presenting symptoms in Western patients. Chinese books differentiate, first of all, between headaches of internal origin and those of external origin, but the latter are not frequently seen in practice. When asking a patient about headaches, it is important to ask systematically about onset, time, location, character of pain, and ameliorating or aggravating factors. First, the onset. A recent onset and short duration indicate headache from exterior invasion of wind. A gradual onset with long duration indicates headache from interior causes. Time, we ask. Headaches occurring in daytime usually indicates Qi or Yang deficiency, while headache occurring in the evening may be due to blood or Yin deficiency. Headache starting at night during sleep indicates blood stasis. The location. The occiput or the greater yang channels can be from exterior invasion of wind if the pain is severe, or from interior kidney deficiency if the pain is dull, as seen in this picture. In this photograph, we see the location as a frontal headache. So in the forehead, this is the bright yang channels. This can be from stomach heat or blood deficiency. In this picture, the location is at the temples. So the temples inside of the heads, this is the lesser yang channels, and can be from exterior wind in the lesser yang or from liver yang rising. In this photo, we see the vertex. This, if the headache is from the vertex side, then the terminal yin or the terminal yin channels, this is usually from deficiency of liver blood. If the headache is in the location is the whole head, so this is exterior invasion of wind heat or kidney deficiency. The temples or side of head and eye, if that is the location of the headache, is lesser yang channels. This is usually from liver yang rising. If the headache is from behind the eyes, the location is behind the eyes or the liver channel, it is either liver yang rising or liver blood deficiency. Now let's go to the character of the pain. If it is a dull ache, this usually indicates deficiency, while an intense, sharp pain usually indicates excess. A throbbing and distending pain indicates liver yang rising. A pulling pain indicates liver wind, and a fixed, boring pain indicates blood stasis. A dull ache with the head feeling as if it were wrapped or in full of cotton wool, and a sensation of heaviness indicate dampness or phlegm. Headache that is experienced inside the head is usually due to kidney deficiency. Fifth, if the headache is ameliorating or due to aggravating factors, so chronic headaches that are improved by rest are due to a deficiency. If they are improved by exercise, they are due to liver fire, phlegm, or blood stasis. If the headaches aggravated by lying down usually indicate a fullness. This is liver yang rising, liver fire, could be phlegm or blood stasis. And if they are ameliorated by lying down, they usually indicate a deficiency. Headaches that are improved by eating usually indicate a deficiency. If they are aggravated by eating, they usually indicate an excess, especially phlegm or retention of food. The differentiation of headaches is best done by distinguishing headaches of interior origin from those of exterior origin. Thank you for your attention.
Okay. Let's proceed to acupuncture analgesia with acupuncture and TCM. Acupuncture is an effective needling technique from traditional Chinese medicine dating back 3,000 years. Although historically it has been used to treat a variety of different health problems, including obesity, infertility, and colds, it is also commonly used to alleviate pain. Acupuncture started gaining in popularity and acceptance in the late 20th century as both a solo and an adjunct therapy for the treatment of pain. By mid-1990s, support of both physicians and patients to integrate acupuncture into Western medical practice was growing. In November 1987, on the basis of well-designed studies, the National Institute of Health supported the use of acupuncture for pain, nausea, vomiting, and post-stroke dysfunction. This increased awareness in the Western community has led to more evidence-based research to clarify the mechanisms of acupuncture analgesia. Although there is no one clear pathway, this chapter will review recent literature and scientific theories. Now let's discuss acupuncture and traditional Chinese medicine. It is difficult to translate the mechanism of acupuncture and analgesia in Western terms because the philosophy of TCM is entirely different. In brief, TCM believes in the theory of holistic balance between the yin and yang, and problems arise when there is an imbalance. Acupuncture is used to balance the yin and yang, which are manifested to regulate the qi or energy and blood. Qi travels through channels called meridians in the body. There are essentially 20 channels with access points called acupuncture points. strategically aligned along the meridians, which can be manipulated through various techniques to achieve balance of the qi. These techniques include acupuncture or percutaneous insertion of a fine needle, moxibustion or thermal therapy using the moxa roll herb, acupressure or deep pressure without dermatologic invasion, or electroacupuncture. This is acupuncture with electrical stimulation of needles at acupoints. Even with acupuncture alone, there are specific techniques of twisting the needle side to side and up and down to capture the qi. The practitioner often describes this capture termed that qi, a sense of tightness around the needle as it enters deep tissues. In TCM, it is thought of as the fish taking the bait, when the acupuncture point stimulates the imbalanced qi. The sensation experienced by the patient is often soreness, numbness, heaviness, or even an electrical sensation. Acupuncture relieves pain and illness by unblocking stagnant qi in the meridians, thereby restoring the balance between yin and yang. So, translating acupuncture analgesia in terms of Western medicine and evidence-based research. Since the 1970s, there have been a growing number of evidence-based research studies employing a variety of different modalities, ranging from human and animal studies to those using technologically advanced imaging to investigate the mechanism of acupuncture analgesia. A rising series from current literature describe a neural basis for its effect involving the peripheral and central pain pathways. Thank you for listening.
Differential diagnosis for epigastric pain. Let's start with the Western differentiation. Epigastric pain can arise from a gastrointestinal pathology. So we have gastritis. This time there will be indigestion, loss of appetite, nausea, vomiting blood, dark stools. Peptic ulcers, the epigastric pain is accompanied by fatigue, nausea, vomiting, indigestion, chest pain, vomiting blood, tarry stools. Pancreatitis, the epigastric pain, is associated with mild jaundice, nausea, vomiting, fatty stools, chills, fever, sweating, weakness, weight loss. Esophagitis or reflux, there will be epigastric or central chest pain, heartburn, difficult, painful swallowing, symptoms worse, lying flat. For cholecystitis, there is also chronic indigestion, nausea, and bulging. Gallstones, there will be cramping pain in the right upper quadrant or epigastrium, may radiate to back or right shoulder blade. Fatty food aggravates jaundice and fever. For carcinoma, there is loss of appetite or weight, plus if it is stomach carcinoma, there is difficulty swallowing, abdominal fullness, nausea, vomiting blood, halitosis, flatulence. Esophageal carcinoma, there will be food regurgitation, aside from epigastric pain, difficulty swallowing, vomiting blood, and chest pain. Esophageal pancreatic carcinoma, there will be jaundice, nausea, vomiting, fatigue, diarrhea, indigestion, clay-colored stools. Irritable bowel syndrome, there will be epigastric pain with diarrhea and or constipation, abdominal distension, flatulence. For dyspepsia, there is vague abdominal discomfort, feeling of fullness, belching, bloating, and nausea. If the epigastric pain is stemming from heart pathology, we have the referred MI, myocardial infarction. There's apparent indigestion, shortness of breath, sweating, dizziness, fainting, nausea, vomiting, anxiety. Epigastric pain stemming from lung pathology. This is referred lower lobe pneumonia. There is referred epigastric pain, cough with green-yellow mucus, fever, shaking chills, sharp chest pain, shortness of breath. Other causes will include medications. Now let's go to Chinese differentiation of epigastric pain. Diagnostic questioning according to nature of pain. If it is severe or excess, A severe epigastric pain, that's excess. Severe acute colicky, that's cold. Dull epigastric pain is deficiency. Stubbing, fixed epigastric pain, there is stasis of blood. Distending or vague location, that is stagnation of qi. Burning with acid reflux, excess or deficient heat. Oppressive, damp or phlegm. Stuffy, stomach qi deficiency or stomach heat or fire. Epigastric pain with nausea, phlegm or damp. Full, there is full epigastric pain, there is retention of food or water and damp. Intermittent related to stress, stagnation of liver qi. Epigastric pain is sudden, violent, that's cold, stagnation of food. Diagnostic questioning according to time of pain. If there is epigastric pain on waking, that is phlegm damp. Epigastric pain that occurs in the morning is deficiency. Epigastric pain occurring in the afternoon, this is stagnation of qi. Epigastric pain occurring at night is blood stasis or yin deficiency. If the epigastric pain causes you to wake up between 2 and 3 a.m., that's qi stagnation. Diagnostic questioning according to amelioration and aggravation. If the epigastric pain feels better for eating or pressure or rest, that is deficiency. If the epigastric pain gets worse for pressure or eating, that's excess. Better for warmth, that's cold. Better with slight exercise, stagnation of qi or blood. Better for vomiting, defecating or belching, excess condition. Worse for vomiting, deficient condition. According to etiology, external evil, so that's cold or heat, poor diet and poor eating habits, emotional stress, anger, pensiveness, worry, prescribed drugs. Zhang-Fu patterns for epigastric pain. External, that's cold invading the stomach, damp heat invading the stomach. Internal, we have excess and deficiency. For excess, we have food stagnation in the stomach, liver invading the stomach, stomach phlegm, fire, stasis of blood in the stomach. Deficiency, spleen, stomach, qi, yang deficiency, stomach yin deficiency. Thank you for your attention.
Continue about relationships among Zhang viscera. Now the heart and the liver. Heart and liver. The relationship between the heart and the liver is mainly demonstrated in blood circulation and in mental and emotional activities. First, let's talk about blood circulation. The heart governs blood. The liver stores blood and regulates the amount of blood in the circulation. These two physiological actions must be integrated in order to meet the needs of the entire body for blood supply. Only if heart blood is plentiful can the liver have blood to store, be adequately nourished, and ensure a normal amount of blood in the circulation. Deficiency of heart blood can lead to deficiency of liver blood and vice versa, so that deficiency of heart blood and deficiency of liver blood tend to develop together. The usual symptoms are tightness of chest, palpitation of the heart, a pallid complexion, dizziness, blurred vision, withered nails, and scanty or delayed menses. In this diagram, we see the relationship between the heart and the liver. So the heart stores the mind, the liver stores the will or an ethereal soul. The heart governs the blood while the liver stores the blood. And the blood is the material basis for the mind and will and ethereal soul, which is our emotions. So there's a direct relationship between the mind and the ethereal soul if there's harmony between the heart blood and liver blood. So in mental and emotional activities, the heart houses the mind and controls mental activity, and the liver regulates the emotions. Thus, the mental, consciousness, and thinking activities are intimately associated with both the heart and the liver. Blood is the material basis for mental and emotional activities, and it is controlled by the heart and stored by the liver. These two organs cooperate and work in harmony to maintain a normal mental and emotional state. Deficiency of both heart blood and liver blood causes the mind to lose its nourishment, and such symptoms as palpitation of the heart, insomnia, and dream disturbed sleep may appear. Loss of the conducting and facilitating functions of the liver may lead to chi stagnation and production of endogenous fire, which transform fluids into phlegm. The phlegm fire can rise up and disturb the mind, causing restlessness, insomnia, irascibility, erratic behavior, and incoherent speech. Thank you for listening.
Let's now discuss diagnosis according to Zhang Fu organ patterns with the pattern urinary bladder stones. This will be a chronic pattern that has arisen as a consequence of other chronic patterns of imbalance. Heat will usually be the precursor, boiling the urine so it eventually forms small stones or sand. Dampness can coagulate and form phlegm, which can manifest as stones and sand in the urine. Now let's look into its etiology. Chronic patterns of heat that usually underlie this pattern can be due to a residual pathogen. This will usually be due to the use of Western medication that has not fully cleared the pathogen. Both dampness and heat can lead to the formation of phlegm. This means that etiological factors such as diet that creates heat or dampness can be involved. Likewise, emotional factors can lead to the creation of heart fire that can drain down to the urinary bladder and boil the urinary fluids, resulting in stones. Symptoms and signs: sudden or recurrent painful and blocked urination, inhibited urinary flow, incomplete voiding of the urinary bladder, piercing or cutting pain in the urethra that is better when urine flows freely, small stones or sand in the urine, tightness, pain, or distension in the area above the pubic bone. The tongue impression will depend on the underlying pattern of imbalance, wiry or confined pulse in the left urinary position. The key symptoms here are small stones or sand in the urine and painful urination. Treatment principle: we expel stones and circulate qi in the urinary bladder. For the acupuncture points, we can choose from REN3, stomach 28, bladder 28, and bladder 32. For the needling technique, we use draining, and electroacupuncture is also recommended. For the explanation on the choice of points, REN3, stomach 28, bladder 28, and bladder 32 activate qi and expel stones from the urinary bladder. A relevant advice will depend on the underlying pattern of imbalance. If there is heat or dampness, the patient should avoid consuming food and beverages that generate this. Any underlying emotional issues or stress should be addressed. Physical exercise and massage, where the focus is on circulating qi in the lower jaw, will be beneficial. Hula hoops, sit-ups, and rowing machines can help to do this. Urinary bladder stones can be caused by urinary bladder damp heat, liver qi stagnation, and urinary bladder qi stagnation, and urinary bladder blood stagnation. And in turn, it can result to urinary bladder or urinary blood stagnation. Thank you for listening.
Endogenous pathogenic evils, we discuss endogenous dampness and endogenous dryness. Decline or loss of transportation, transformation, and distribution by the spleen often results in disturbed water and fluid metabolism. This in turn leads to retention of water and fluids. Since the retained water and fluids are not dispersed efficiently, they transform variously into dampness, phlegm, or rheum. This situation arises mostly because of spleen deficiency due to chronic illness or stomach injury due to excessive ingestion of foods that are raw and cold or fatty and sweet. The key defect leading to this abnormal state is the failure of water transportation and transformation by the spleen. Hence, the plain question states, and many dampness disorders are characterized by swelling and fullness. They are all related to the spleen. Dampness is characteristically heavy, turbid, viscous, and static. It readily blocks chi movement, though the effects vary in accordance with its location. If dampness is in the upper jaw, there are chest tightness and cough. In the middle jaw, epigastric and abdominal distension, poor appetite, and a thick and greasy tongue coating. And in the lower jaw, abdominal distension, diarrhea, and dysuria. If dampness is in the skin and in the interstitial spaces of the muscles, there is edema. It should be pointed out that though turbid dampness can encumber every part of the body, it is the spleen and the stomach in the middle jaw that are most often affected. Though there are differences between exogenous and endogenous dampness, the two often influence each other. When the external dampness pathogenic evil attacks, it often injures the spleen and compromises spleen functions. Loss of transportation and transformation by the spleen in turn leads to accumulation of endogenous turbid dampness. Hence, in clinical practice, whenever the spleen's functions are diminished, the susceptibility to exogenous dampness is increased. Now let's talk about endogenous dryness. When body fluids are insufficient, all the organs, tissues, and orifices of the body lose their moisture and nourishment. This in turn leads to the pathological changes of dehydration. That is to say, impairment of body fluids turns into dryness. There are many causes for this condition. Prolonged illness can damage yin and exhaust yin fluid. Profuse sweating, severe vomiting or diarrhea, and massive loss of blood or essence can all diminish yin and fluids. In other illnesses, the heat evil can injure yin, or the dampness evil can transform into dryness. The insufficient body fluids cannot adequately nourish the zangfu viscera or moisten the interstitial spaces of the superficies and orifices, thus producing the pathological changes of the endogenous dryness syndrome. The clinical manifestations of fluid depletion include dry and rough skin, sometimes with scaling, clapped mucous membranes, dry mouth and throat, dry or denuded, cracked and red tongue, dry nose and eyes, brittle nails, constipation, scanty dark urine, dry cough without sputum, or blood-streaked sputum. Thank you for your attention.
Let us now go to pathology of qi and emotional problems. The topic is heart qi stagnation and lung qi stagnation. The first effect of emotional stress on the body is to affect the proper circulation and direction of qi. Qi is non-substantial, and the mind, with its mental and emotional energies, is the most non-material type of qi. It is therefore natural that emotional stress affecting the mind impairs the circulation of qi and disrupts the qi mechanism first of all. Although each emotion has a particular effect on qi, for example, anger makes it rise and sadness depletes it, all emotions have a tendency to cause some stagnation of qi after some time. Here we can see the qi stagnation from emotional stress, where the emotion affects the qi and the qi will rise or descend or not or dissolve, and will eventually lead to qi stagnation. Even the emotions that deplete qi, such as sadness, may cause some qi stagnation, because if qi is deficient, it cannot circulate properly and it therefore may tend to stagnate. For example, sadness depletes lung qi in the chest. The deficient qi in the chest fails to circulate properly and it causes some stagnation of qi in the chest. The patterns of heart qi and lung qi stagnation are not often mentioned, but they are very common in mental emotional problems, and for this reason they are reported as follows. Heart qi stagnation. The clinical manifestations of heart qi stagnation are palpitations, a feeling of distension or oppression of the chest, depression, a slight feeling of lump in the throat, slight shortness of breath, sighing, poor appetite, chest and upper epigastric distension, dislike of lying down, weak and cold limbs, slightly purple lips, and pale complexion. The tongue will be slightly pale purple on the sides in the chest area, and the pulse will be empty but very slightly overflowing on the left front position. The points to use are heart 5, heart 7, pericardium 6, Ren 15, Ren 17, lung 7, stomach 40, and LI 4. For lung qi stagnation, the clinical manifestations are a feeling of a lump in the throat, difficulty swallowing, a feeling of oppression or distension of the chest, slight breathlessness, sighing, sadness, slight anxiety, and depression. The tongue will be slightly red on the sides and the chest areas, and the pulse will be very slightly tight on the right front position. The points to use are lung 7, stomach 40, Ren 15, and pericardium 6. Thank you so much for your attention.